Have you ever wondered what the secret to a long, healthy life is? We often look to Japan, a country known for its impressive longevity. What if I told you that one of Japan's oldest and most respected doctors shared a simple 10-second trick that could significantly reduce your risk of stroke, especially after the age of 60? It sounds almost too good to be true, doesn't it? But stick with me because this incredible piece of advice comes from a lifetime of medical practice and wisdom. Today, we're diving deep into the teachings of Dr. Shigeaki Hinohara, a Japanese physician who lived to be an incredible 105 years old. He wasn't just known for his age. He was a revolutionary figure in Japanese medicine, actively treating patients well past his 100th birthday. Dr. Hinohara believed that many common health issues, including the risk of stroke, could be managed and even prevented with simple daily habits. And the one we're focusing on today involves something you use every single day: your tongue. So, what is this mysterious tongue trick? It's incredibly simple, and you can do it right now. All you need to do is stick your tongue out as far as you can, and then try to touch your nose with the tip of your tongue. Hold it for a few seconds. Now, try to touch your chin with the tip of your tongue. Go back and forth, stretching your tongue up towards your nose, then down towards your chin. Do this for about 10 to 20 seconds. That's it. That's the entire exercise. I know what you're thinking. How can something so simple possibly help prevent a stroke? To understand this, we need to look at the connection between our tongue and our brain. The tongue is not just a muscle for tasting and talking. It's intricately connected to our cranial nerves, which are directly linked to our brain. When you stretch and move your tongue in this specific way, you're actually stimulating these nerves and, by extension, the brain itself. A stroke, in simple terms, is a brain attack. It happens when the blood supply to part of your brain is interrupted or reduced, preventing brain tissue from getting oxygen and nutrients. This can be caused by a blockage, which is an ischemic stroke, or the bursting of a blood vessel, a hemorrhagic stroke. The key to prevention is maintaining good blood flow and brain health. This tongue exercise acts like a form of brain gymnastics. The movements stimulate blood circulation in the head and neck area. Think about it. When you perform this stretch, you can feel the muscles at the base of your tongue and in your neck engaging. This gentle stimulation helps improve blood flow to the brain, which is crucial for preventing the blockages that can lead to an ischemic stroke. Improved circulation means your brain cells are getting a steady supply of oxygen-rich blood, keeping them healthy and resilient. Furthermore, this exercise has a connection to traditional Eastern medicine principles. In many ancient practices, the tongue is seen as a map of the internal organs. Its condition, color, and coating are often used to diagnose underlying health issues. The act of stimulating the tongue is believed to help balance the body's energy, or qi, and promote overall wellness. While modern science focuses on the neurological and circulatory benefits, it's fascinating to see how ancient wisdom and contemporary medicine can align. Dr. Hinohara advocated for this exercise as a daily routine, especially for those over 60. As we age, our blood vessels can become less flexible, and the risk of plaque buildup increases. This makes us more susceptible to strokes. Incorporating this simple 10-second stretch into your morning routine, perhaps while you're brushing your teeth or waiting for your coffee to brew, is an easy and proactive step you can take for your brain health. It requires no special equipment, no gym membership, just a few seconds of your time. But let's be clear, this exercise is not a magic cure. Dr. Hinohara was a firm believer in a holistic approach to health. He emphasized that this tongue trick should be part of a larger, healthy lifestyle. So, what other advice did this centenarian doctor live by? First, he was a huge proponent of staying active. Not necessarily by running marathons, but by incorporating movement into daily life. He famously took the stairs instead of the elevator, carried his own luggage, and maintained a busy work schedule. His motto was that retirement was an unnecessary concept if you love what you do. Finding joy and purpose in your daily activities keeps both your mind and body engaged. Second, nutrition was key. Dr. Hinohara's diet was modest. For breakfast, he often had coffee, milk, and some orange juice with a tablespoon of olive oil. He believed olive oil was excellent for the arteries and kept his skin healthy. Lunch was often just milk and a few cookies, or nothing at all when he was too busy. His main meal was dinner, which consisted of vegetables, a little fish and rice, and twice a week, 100 grams of lean meat. The key takeaway here is moderation and focusing on nutrient-dense foods, rather than overindulging. Third, he stressed the importance of having fun. He believed that worry and stress were incredibly detrimental to health. He said, "Pain is mysterious, and having fun is the best way to forget it." Engaging in hobbies, spending time with loved ones, and finding joy in the small things were essential parts of his prescription for a long life. Laughter, he believed, was truly the best medicine. So, when we combine the 10-second tongue exercise with these other pillars of health, staying active, eating a balanced diet, and managing stress by having fun, we create a powerful strategy for longevity and stroke prevention. The tongue trick is the easy entry point, the simple habit you can start today, right now. Let's try it again, together. Stick your tongue out. Reach for your nose. Hold for a couple of seconds. Now reach for your chin. Feel that stretch at the base of your tongue. That's you, actively improving circulation to your brain. It's a small action, but done consistently, it can have a big impact. It's important to remember that this advice is for prevention. If you or someone you know is experiencing symptoms of a stroke, like sudden numbness or weakness in the face, arm, or leg, especially on one side of the body, confusion, trouble speaking, or a severe headache, you must seek emergency medical help immediately. Time is critical in a stroke situation. The wisdom of Dr. Shigeaki Hinohara teaches us that taking control of our health doesn't have to be complicated or expensive. It's about being mindful, making smart choices, and incorporating simple, effective habits into our daily lives. The 10-second tongue exercise is a perfect example of this philosophy. It's a testament to the idea that small, consistent efforts can lead to profound, long-term benefits for our health and well-being. So, why not give it a try? Make it part of your daily routine. Think of it as a small gift you give to your brain every day. It costs you nothing but a few seconds, but the potential reward, a healthier, longer life with a reduced risk of stroke, is priceless. Thank you for joining me today to learn about this fascinating piece of advice. I hope you found it as inspiring as I did. If you enjoyed this video and want to learn more simple tips for a healthier life, please give it a thumbs up and don't forget to subscribe to the channel. Stay healthy, stay happy, and I'll see you in the next video.